This is a presentation on pubic joint x-ray for vertical instability. I'm Jerry Hesch with the Hesch Institute, which is near Las Vegas, Nevada in Henderson. Website is www.heschinstitute.com. We do consultation treatment for complex pain syndromes, and we do seminar and distance learning. And again, we're talking about pubic joint x-ray for vertical instability. There are different protocols for looking at the pubic joint for potential instability. One involves standing on one foot, taking an x-ray, and then standing on the other and taking an x-ray. And another protocol involves standing on a box with the weighted leg hanging off the edge, meaning that they add perhaps 5 pounds to the ankle. And sometimes these x-rays are taken with the client lying on their back, such as in this anatomical model, and other times they are taken, like our skeleton here, they are taken with the person in standing. Now the plane of the pubic joint, the front of the pubic joint, which I'm pointing to right here, lies at an angle. If you were to look at it sideways, it lies in a different angle in different individuals. The average, if you were to look at the pelvis sideways, here is the pubic joint. So if you look at somebody laying sideways, you can get a general estimate of what that angle is. And that angle is very relevant to our conversation here. So in this anatomical model here, I've propped it on a wedge. And I've used a inclinometer here, also called a protractor, which you can buy at a hardware store. And I placed it against the sacrum here and against the pubic structure. And this is not particularly precise, but it's not significantly imprecise either. I am the cameraman here. My staff is away for today. So anyway, when I place that pelvic bone on that wedge, we get approximately 45-degree angle. So if we shoot an x-ray from a purely perpendicular angle, from perpendicular to the person's body, realize that we don't see the plane, we are not perpendicular to the plane of the pubic joint. Okay, if we shot an x-ray at an angle that was perpendicular to the pubic joint, we would get different information. I want to try and demonstrate that. So let me zoom in there. And you can see that I have taped 2 pieces of metal. I'm going to zoom in there. So if we take an image being nearly perpendicular, and I can place this protractor on the camera, and it is very close. It's a little more like 50. Let me back it up a little bit. Alright, so that's more like a 45-degree angle. And we look at the distance here relative to the vertical difference. I see 5 millimeters. If instead we look straight down, you will notice that they almost look like they are horizontal. Looking straight down, I see perhaps a 1 millimeter difference. My point being that when we shoot an x-ray that is perpendicular to the person's body, we can miss a considerable vertical difference that will be captured only when we shoot perpendicular to the front of the pubic joint. I'm going to take my camera off the stand, off the tripod, and cover that concept one more time. So right now, this camera is essentially perpendicular to the front of the pubic joints here. Okay, so here's one metal rod, and here's another. And you can see that there is a considerable distance, and we looked at that a while ago, came across there with a ruler, and you can see the difference in height. I don't have 3 hands, but I then applied one over here and looked at the vertical difference and came up with 5 millimeters. But if we shoot that x-ray perpendicular to the person's body, you can see that those two look essentially equal, and so there is no evidence for a vertical instability. The reason that happens is because the top of the pubic structure is fairly wide, perhaps a 1/2 inch wide. And to sum everything up, when looking for a vertical instability using x-ray, it is ideal in a static view to shoot it perpendicular to the plane of the pubic joint. And for certain protocols, that does add another layer of complexity, but nonetheless, this is an important consideration. Thank you very much.